So now just to get into the details of the poor country data. So what we ended up doing was so just like I was collecting data in Sierra Leone, Nepal, Bangladesh, other collaborators were collecting data in other countries in Africa, Latin America, and South Asia. And we put all of it together in order to try to paint a comprehensive picture of the nature of the economic shock across the developing world, across low and middle income countries. Okay. And so this was a coordinated effort across many different institutions. So me and my research team at Yale, but also professors at Northwestern University, at UC Berkeley, and the International NGO Innovations for Poverty Action, right? And we all, in 15 different samples, we conducted phone surveys. And since then, many other organizations have replicated this particular approach of conducting phone surveys. So now we have data available like in close to 100 countries, okay? And so why do we do phone surveys? So first of all, you can't do in person, but why surveys? Why don't you just look at administrative records like you would in the US? And the reason is that in low middle income countries, a lot of people are in the informal sector. So they fall outside of government administrative records. You can't easily get a handle on what's happening to those populations without directly talking to them. And directly talking to, say, representative samples of people as opposed to people who show up in official records. Right? And so I'm going to show you like overall what we find in the next 5 minutes, overall what we find across these 15 different samples, right? Now we get into some details of like in specific subsamples, we start collecting much more details on things like what are the gendered effects of COVID, or what are the effects of border closures, or effects on specific subpopulations like migrants who have had a more acute economic shock from COVID, just because mobility was interrupted. What's happening to agricultural households, what's happening to seasonal hunger, etc. Right? All right, but today we'll just talk about the overall effects. And before getting into the data, just where the data comes from. So many are phone surveys of earlier studies representative of subpopulations like the Nepali agricultural households I was telling you about, right? But then we added sort of new samples where we just did random digit dialing of cell phone numbers, right? And those were national in scope, okay? And then, you need to look at what the COVID effect was, you would need to look at the post-pandemic living standards relative to something, and that relative to we do is pre-COVID period, right? So in the surveys that we already had prior to COVID, we have a very good counterfactual there. We know exactly what people's lives looked like before the pandemic, so we can do that comparison. And in the new surveys, we just ask retrospective questions. Okay? And so all in all, we have about 30,000 household survey respondents in 16 different samples across Africa, Asia, Latin America. And this paper was written in July of 2020. So that tells you like the dates around which our data will be representative. It'll be early in the pandemic. We ask about their shocks to income, employment, reduced access to markets, whether access to healthcare was delayed, their food security, food insecurity and hunger situation, and whether or not they're receiving government support, right? And so the bottom line is that while the magnitude of the effects will vary across the different samples and setting, we'll see a very consistent picture of staggering economic distress that was early in the pandemic, and it spans both geography as well as socioeconomic strata. So we see this effect both in middle income countries and very low income countries, right? We have our sample spans Colombia, which is firmly middle income, to Sierra Leone, which is a very poor country. And we also see within samples, rich versus poor people have similarly large effects on some outcomes at least. Okay, so I'm not going to go through this. I'll just put it up there in case you want to see the details. You can always pause the video to take a look at this as to when the surveys were conducted in each country, right? And here's the situation in those countries. Again, you may pause if you like, which is that like in all these countries, there were cases happening at the time that the data was collected. And there were, say, school closures, there were lockdowns, etc. So all of the economic effects we'll study is not just the effect of COVID, but also responses to COVID. So it could be that the economic shock is because of the virus, or it could be it's because of the lockdown. And it's not possible for us to separate which of these two factors is the underlying causal factor. All right, so now onto the results. So across these samples, up here, I'll just tell you the median, and this is where you see the variation. You see between 8% to 87% of respondents reporting a drop in income during the pandemic. Okay? And interestingly, the 8%, the lowest drop, is in the sample of refugees in Kenya who live in UNHCR camps. So part of it is that they weren't allowed to work very much to begin with, right? And then relatively small effects again among Rohingya refugees living in Bangladesh. That's one of our samples. Also because there's there's like a humanitarian infrastructure that was in place there to give support, but there are like countries like in Colombia where 87% of people, Rwanda, Sierra Leone, where similarly large fractions of people are reporting drops in income. Okay, and there's also a drop in employment of between 5 and 49%, and the median is about 30%. The drop in income is really high; it's like 70%. Okay? And one other point here is that the median drop in income of 70%, if you look at the top half of each sample versus the bottom half in terms of socioeconomic status, you see similarly large drops. So it's not like this is a crisis that only hit the poor people in these countries. It hit both people who were doing relatively well in these samples as well as people who are in relative terms doing very, very poorly. Okay. And lots of people report reduced access to markets. About a third of all respondents say that they couldn't access markets as well, right? And in a few of the samples, we collected data on delayed access to healthcare. So about 13% of people overall say that healthcare was delayed, okay? And so we saw large drops in income employment, right? And we see that like people are not able to cope well with it. So about on median, 45% of people are reporting that as a result of the income employment drops, they're actually missing or reducing meals. They're not able to smooth consumption. They're not able to dip into their savings or borrow or whatever in order to make sure they eat enough. So this is a very bad form of coping, which is children not getting adequate nutrition, right? And here we see that when you look at food insecurity, that the drop in consumption is happening more among the lower socioeconomic status rather than high. So even though the income drop hit everybody, right, this is translating into a consumption drop, food insecurity and hunger among people who are relatively more poor. And finally, even though the income and employment effects are so staggeringly large, only 11% of people across all our samples are reporting that they were receiving some form of support from governments or NGOs in order to help them cope with the crisis. So early on, like everybody was, I guess, startled and distracted by the epidemiological crisis and what to do about the virus. And the economic shock really did hit people hard without getting immediate support from their formal institutions. And one final thing I'll add here is that you might worry that like when I show you drops in income employment, any social scientist would worry, oh, maybe that's a type of drop that would happen during this season anyway, because as we talked earlier, this is outcomes in these environments is seasonally varying anyway, right? So here I just point out that in the places like in Nepal, Bangladesh, where we have a lot of pre-pandemic data, we can plot exactly what the seasonality is. That's the black line, right? And you see that in 2019, like the more recent round of data, but pre-pandemic, that year was looking exactly like any other normal year. The blue dots line up perfectly with the black line, but only in the post-pandemic period, you see that the food insecurity is unusually high, right? So this picture tells you two things. So one is that this really is like, even after you account for the seasonal variation, this pandemic did really harm people. And the second thing it tells you is that like we were kind of lucky that the pandemic hit during the harvest period, right? Whereas if the pandemic had hit during the lean season, that would have been much more dangerous and fatal. Okay, thank you very much for listening, and I'll stop there.